This your Houston chiropractor, Dr. Gregory Johnson. We have Eric in here with us this morning. Eric flew all the way down here with his wife from Youngstown, Ohio. And he has been having a fit with his right shoulder. Similar to Renee, he's got adhesive capsulitis in there. They've already done surgery on his right shoulder, and now he's got limited range of motion. Go ahead and show him what your range of motion is. See, he's locked up right there. It pinches right there, doesn't it? Mm-hmm. He's got internal rotation, external rotation issues. Go back like this. Externally rotate, it hurts too, doesn't it? Mm-hmm. Does this make that worse? Mm-hmm. Yeah. That's a martial arts move there. Okay, so this is his very first visit here at Advanced Chiropractic Relief. He's had chiropractic care, he's had physical therapy, and what else? Massage therapy?
Yeah, I've had massage therapy.
Physical therapy, and so you can see his head's a little forward, transloaded off to the left. He saw me working on Renee's shoulder, she's got adhesive capsulitis too. Alright, so I've already done his history and orthopedic neurological evaluation, so I'm going to give him his first adjustment here today. Now, since yesterday was Labor Day, we weren't here, so this is our first post-Labor Day video. Hope y'all had a good Labor Day weekend. Renee and I were hot-footing it back and forth to North Houston Imaging for her shoulder the whole weekend. Tender right there too, yeah. So he's got bilateral SI joint subluxations. That's what the initial examination showed. He has a right sacral deviation test as well. So I'm adjusting his, or left sacral deviation, I'm sorry. Sacrum, superior to inferior. Right SI joint. L5, straight P to A. Same thing on L4. Now on L3, you start seeing the angles changing. There, okay. There. So maybe what right leg was a half inch shorter, now it's even. Eric, this should feel a little easier already than that first one. Yes. Good. Okay, let's turn you on your back, please, sir. Now, when you're dealing with what's called adhesive capsulitis, that is fibrotic adhesions and scar tissue in and around the synovial joint that just kind of proliferates out into the surrounding soft tissue. So he's beginning to get frozen shoulder in here, and that's the same thing Renee's been dealing with. Let's put both arms out. There you go. Palms up. Is that hard to do that?
To keep it out there, I would say probably. Yeah.
Okay, so I'm going to adjust your shoulders, AC joints, your clavicle. Okay, you can relax your hands right there. So he's had a lot of pretty severe lower back pain and right sciatica as well. There you go, there. Should have felt that from your knee all the way up to your lower back. Mm-hmm. Okay, let this one go too. There you go, good. Okay. Let's go ahead and sit you face that way. So I'm going to start off with your good shoulders. You got some crepitus in there with normal range of motion. You feel a little grinding going on in there, right there? There we go. So you didn't feel it that time, did you? Mm-hmm. Okay, now this one I'm going to take it slow. The key to treating adhesive capsulitis in any joint is just keep moving it through its fullest range of motion, and sometimes it's very painful. Keep breathing. Deep breath in through your nose, out through your mouth. Keep breathing. they show you the doorway stretch, walk up the door
Yes, sir.
thing? Been doing that?
Yes, sir.
Because you got to keep this moving or it's going to get frozen shoulder on you. Swimming, I would recommend highly for this because it's resistance without compressive trauma. Well, look at the difference. I know this is painful. I'm sorry, Eric, but I got to do this if I want to get this moving in a normal joint range of motion. Pay attention, Renee.
I know he's doing better than I.
Our son came down from upstairs at our house this weekend. He thought we were having domestic violence going on. Renee was screaming so loud. Okay. There you go.
Oh.
That wasn't that bad, was it?
No.
Didn't hurt me a bit. Good, okay.
You were nice to Eric.
You notice I adjusted him.
I did.
Mm-hmm. All right, because Renee's getting hers later today.
Yes.
Let's see it, Jeff, face it here again. Just move your right shoulder around right now, Eric, so it's fullest range of motion. That's better than it was when I first saw you.
Yeah, it was.
Yeah, did that hurt as badly?
Not as bad as it's been hurting before now.
Okay, let's go over here. It's really gonna get a workout this week. We're gonna be seeing Eric 3 times a day here for the next couple of days since we weren't here yesterday. The building was shut down, no air conditioning, no electricity. Slide down this way a little bit. Still hot in here this morning. What do you think of this Texas weather?
I do not like it.
Pretty hot, huh? Just let these relax. There. Okay, Eric, just want to keep your teeth together on this one. Don't bite your tongue. There you go. Now you should have felt that all the way down your spine. Very good. He didn't scream on that first one either. Good job.
Right.
Now see, I think as well as with Eric, I think he's got some cervical brachial issues going on because he's had pain further down in his arm and his forearm and his middle fingers, which is C7. So I'm getting way down low in the cervical spine and adjusting that C6, C7. And I brought his MRIs and medical records too, which I've already gone through this morning. If you're coming in from out of state or out of the country, make sure you bring your diagnostic test with you, your medical records, especially if you've had surgery. Yep, sideways, there you go. Now let's stand up here in front of the mirror again. Okay, let's have you flex your head forward and backwards again. Very nice. That's much better already. See, standing up straighter. Pull these up and back. Now, I know this is your shoulder here. There you go. So we're going to bring this head straight back. Okay. Let's try that same movement again. See if this feels any smoother to you this time. Okay, let's come over here in the doorway. This one you're probably not going to like too much. I'm gonna have you facing out that way first. Try to climb up the door frame as high as you can with both sides. Wow, we're gonna move that shoulder now. Okay, kind of lean into that. Now I'm gonna be bouncing his teres major and minor muscles as well as his latissimus dorsi. This is a muscle spindle technique that bounces the muscle spindle, tricking it into relaxing. Pretty painful though, huh? Still ain't hurt me a bit. Okay, now turn around in the doorway the other way, face me, please. You okay? You're doing good so far. Go ahead and climb up same way. But you want to kind of lean into me now. Okay, you're tilting your head a little too much. There you go. Alright, you're really going to love this one. I'm adjusting his acromioclavicular joint now, and also his pec major and minor on both shoulders. I know this is really painful. Okay, good. Now let's come over here in front of the mirror one more time. And I'd like for you to move your right shoulder through its fullest range of motion right now. Try to go up a little higher. Yeah, I knew you did. Keep going higher. There you go. Better, better. Is that as painful right now going through those ranges of motion as it was?
No, not as bad as it was before.
But
I
still
couldn't even get it up as at an angle as it is now, but
Yes,
it
sir.
still hurts.
Yeah, yes. When you have adhesive capsulitis, the scar tissue is more sensitive than normal uninjured tissue. It is also less elastic, meaning it doesn't move as freely. That's why it has such a restriction on his range of motion. And it's permanently weaker than normal uninjured tissue as well. So when he had the surgery in here, they didn't even find any rotator cuff stuff going on, did they?
No.
So they kind of clipped off the end of your chromium process or your clavicle here and made a little room for your AC joint. You had a little spur in there, but you told me that you had more pain even since the surgery than you had before the surgery. So that's why I told Renee, I said, we'll go get the MRIs and stuff then. I said, but if it's surgical, I'm still gonna treat you for 6 months, because once you get the surgery, you can't undo that.
Yeah.
So, you can always have surgery in 6 more months if you need to, but you can't undo it. Okay, so would you mind sharing with our YouTube audience about your very first experience here at Advanced Chiropractic Relief?
It was fantastic.
So you've been watching this on YouTube for a couple of years, right?
Yes, sir.
And you saw me working on Renee's shoulder.
Yes, sir.
You see that? She's a kind of a drama queen.
It hurts, huh?
It does.
It does hurt, and I understand that. I've had torn ligaments myself, but I never had surgery on any of mine, even though they told me I had to. Okay, so this is the first of 6 treatments for Eric. We're going to see him back later today, and then again later on today. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon. Hi, this is your Houston chiropractor, Dr. Gregory Johnson. You know who this is? Oh, I'm sorry, that's her bad shoulder. Renee has been dealing with a really bad left shoulder for the last 4 weeks, actually. This Labor Day weekend, Renee and I spent going back and forth to the imaging center. We had MRIs done on her left shoulder, left scapula, cervical spine, and she does not have a torn rotator cuff, supraspinatus or infraspinatus tear. And I didn't think she did. I thought she had cervical brachial plexus disorder as well as a slip bicipital tendon, but the MRI did not show she had a slip bicipital tendon either. But we went back the following day, on Friday I believe was, right? And got a CT scan done on her scapula and her shoulder to make sure that she didn't have any pathology in her bone marrow, which she did not, which we were very thankful for. And so her definitive diagnosis at this point is capsulitis, which is the same thing as adhesive capsulitis. Bursitis, a lot of people call that too. It's an inflammation of the soft tissue surrounding the glenohumeral joint, which did show some effusion on the MRI. So we had a patient come in today from Ohio that has exactly the same thing, and we did him 3 times today, increasing his range of motion 100% in just 3 visits, and reduced his pain substantially. Now Renee, she's a little bit of a drama queen, so hers still hurting.
Mine
So-
still hurts.
Okay, honey. Let's have you close your eyes and flex your head forward. I want you to show you though, and we're tagging this video next to Eric's video, who I've seen 3 times today as well, so you can see that I treat my patients exactly like I do my family. Okay, flex you forward and backwards. Neutral. Okay, so you can see she's a little forward and translated to the right. Now, I've tried to get Renee to sleep on her back with no pillow for years, and just that doesn't work. She sleeps on her side all the time.
Yeah.
Show them your left shoulder range of motion, honey.
Oh, right there.
Starts hurting really bad right there.
Oh, yeah. It's
Okay.
it's painful.
So the first thing I'm going to do on here is I'm going to decompress her spine. I adjusted her at home all weekend and massaged on her upper back and cervical spine and her scapula all weekend. And it felt a little better for a while, but it's come back. So I'm going to continue to decompress her.
You don't realize how much you use it.
Slide up that way. You know, there was the only specific incident that we can relate to her shoulder injury was lifting a great big old 50-pound container of salt for the water softener, right?
Yeah, it's a bag.
Big bag, and you were lifting it out the trunk of the car,
When I turn.
twisted simultaneously. But she's had cumulative or repetitive trauma to her left shoulder just by being on the computer all the time at the front desk. There you go. Okay, and just breathe through your nose with your right ear. There you go. And yes, she's still kicking. So I'm gonna get down really low and adjust her. Boy, that was moving before I even did the thrust. I got you. There you go. Yeah, you tightened up on that one,
I
didn't you?
did.
Ding dong.
I know. I have to do it this way.
Okay.
I know, it's such a pain. To put it down, it really hurts.
Yeah, we got it, honey. It hurts. Families always make the worst patient. So even though she's got capsulitis in her left shoulder, I'm still going to adjust her entire spine and body because we want to create as much proprioceptive neurological bombardment into the cerebellum as possible. There you go.
Oh. Oh, God.
There we go. That's it. That's why crack addicts love you, honey.
Oh, God.
Because you're a really loud cracker and you're a screamer too.
Oh. Oh, God.
Okay, breathe. I had to teach Renee how to breathe all weekend. There you go. Okay, let's turn you on your back now.
Oh, God. Oh. Trying.
Yeah, you're doing fine. I know it hurts.
Oh.
I've been working on her cherries major and cherries minor all weekend, and it's still hard as a rock. But today, you're gonna see me doing something in the doorway that she hasn't had done yet. Go ahead and put both arms straight out.
Oh, gosh.
So I'm adjusting her AC joints, her clavicles, where they attach to the sternum, and then her anterior costosternal joints as well. There you go. Okay, keep breathing.
Oh.
Keep breathing. There you go. There we go.
Oh, God.
Okay.
I don't know if I can get this out yet.
Here, let's see. Yes, you can.
Oh.
I'll do your good one first.
Oh.
And even though I say this is a good one, this one's about to fall out of its socket too. There he is.
Okay.
I know, honey. I'm gonna take it easy.
Oh.
Breathe in
Maybe
through
go
your
up
nose,
this
in
way.
through your nose, out through your mouth. I know how to rotate a shoulder.
Wait. It's biting it right there.
I know it is. You gotta you gotta breathe. In through your nose, out through your mouth. Quit talking so much. Breathe in through your nose, out through your mouth. Breathe. You're holding your breath.
Oh, God.
You gotta breathe. Breathe in through your nose, out through your mouth.
It's biting.
If we don't move this shoulder
I know,
through its
I know,
normal
I know,
range
I
of
know, I
motion,
know.
she will get frozen shoulder, and she'll have to have an MUA done.
Oh, God. Oh.
Keep breathing. Deep breath in through your nose, out through your mouth. Okay, lay back on your stomach for a second.
God. My stomach?
Yes.
Oh.
Okay, so the trapezius is right here. Her levator scapula comes down here off her cervical spine to the point of her scapula. Rhomboids are right in here. Now these muscles here are the internal and external rotators of the shoulder. It's called the teres muscles. And I'm just putting a straight, slow, deep, steady pressure in that area. And as you can see, she thinks that hurts a little bit.
God.
Rack them, press them. Now, I'm being nice here, honey.
Sunny beach. Oh, God. Oh. Oh, God. Oh. Oh.
Keep breathing.
Oh, God. Oh. Oh.
Keep breathing deep in through your nose, out through your mouth. Okay, now this one here, slide up in here a little bit.
Oh, God.
I'm going to adjust her T1 and T2 vertebra here where it attaches to the lower cervical spine, C7.
Oh, God.
Okay, breathe. You got to let this go. No, let go. Breathe.
Oh. Oh, my God.
Okay,
Oh.
come over here and stand in the doorway.
God. Oh.
Was it good for you too?
No.
Okay.
Oh, God.
Kind of crawl up the door frame, facing my purpose in life. Renee's thinking my purpose in life is to inflict as much pain on her left shoulder as possible this last couple of weeks, but that's not it.
Oh, that's as far as I
Okay,
go.
lean into it. So what I'm doing now is I'm getting right into the teres major, and I'm doing a bounce on her muscle spindles here. And then, okay, you gotta keep your arm up there.
That's all I could take on that.
No, I'm not gonna do that one again. You gotta put your arm up here though.
Oh.
I'm gonna get down your latissimus dorsi now.
Oh, God.
Stretch it out further. You can go further. Keep going up. Keep going up.
That's it.
Keep going. No, it's not
biting,
it.
It's biting.
I know it is, but you gotta keep going up. This is her latissimus dorsi right here.
Oh, God.
Okay. Now turn around in the doorway. Face me.
Now on the same side.
Turn around the doorway.
Oh, no. I can't
You'll
do
thank
this.
me later.
No.
Put your arms up.
No, let's just.
No, let's just do and say we didn't. Put your arms up there.
Oh my God.
I know it's hurting, but we've got to get through this stage or you're going to get frozen shoulder and it's going to be Katie bar the
Oh,
door.
it's like.
I know what it's like. Okay, climb up the door frame.
Oh God. Where are you gonna put it this time?
Right in the middle of your forehead.
I can't. Oh my
You
God.
can't. You know what can't did, right?
Shut up. That's as far as it's gonna go.
No, it ain't.
Yes, it is.
Oh, you're being a wimp.
Oh my God.
Scoot into it.
Oh, right there. It's biting.
I know it is.
That's
the
it.
scar
I
tissue.
can't.
Okay, you gotta lean into it a little bit.
Mm. Oh,
I haven't even done this treatment on you yet,
oh,
so.
I know. Oh God. That's it. Oh God.
Keep breathing.
Oh.
Breathe.
Oh God. Oh.
See, that wasn't near as bad as you thought.
Oh.
Didn't hurt me a bit.
Oh.
Here, come on in here.
Yeah.
Renee just loves doing these videos. Come on over here.
Oh my God. Oh. Mm.
I'll take good care of you, honey.
Yeah.
Let's have you flex your head forward, backwards, and neutral.
Oh my gosh.
Forwards, backwards, and neutral. Breathe. Okay, so she's not as far translated to the right now. She's more centralized. So just roll your shoulders up and back. You gotta roll them back. You gotta flare these hands like that.
Oh.
And then we're gonna bring your head straight back this way and like this. You're gonna feel a little tap on your atlas there.
Oh God.
Another one there. Now relax.
Oh.
Relax. I'm gonna stretch your spine forward. I'm gonna bounce your muscle spindles in your trapezius muscles, levator scapula muscles, and then all the way down into the rhomboids.
Oh God. Oh. Oh.
These muscles are just like rocks, by the way.
Oh.
Okay,
Oh God.
so I'm done torturing you for a minute. Let's go ahead and close your eyes and flex your head forward and backwards again. Oh, looky there. Imagine that. Now, I want you to move your left shoulder around to its fullest range of motion. Now, look at that. Is that better than it was? It's a lot better range of motion,
It's
yes.
forward up higher.
Yes, it is. And we're going to keep going up higher every day. So make sure you please keep Renee in your prayers for healing on her, because her left shoulder's just been killing her for the last 4 weeks. And you know, I have a lot of tricks in my book to use on her, and I'm pulling out all the stops. So we'll keep following her progress for you. At least she doesn't have to have surgery on her shoulder, which is what we were wanting to avoid in the first place. But we need to get this shoulder moving to its fullest range of motion to get rid of those adverse adhesions and scar tissue that's formed in and around her glenohumeral joint, and we're going to be doing that every single day. This is your Houston chiropractor and your Houston chiropractor's lovely wife with the bad left shoulder, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we treat all of our patients just like they were our own family. We'll see y'all soon.